Prima, I have a question for you. When was the last time that you remembered that you had a positive experience with a healthcare provider?
This was actually during my undergraduate years towards the end. I was not having my period as I should have. It was very concerning. And I went to the doctor, and that is where I was introduced to birth control. And I think within our community, we often think that birth control it's a one purpose thing. But in this case, it actually really helped me out. So that was my first time where I was actually feeling healthier. I had no side effects, which I know many of our female viewers might know that if you're on birth control, it has various side effects. So I talked to my provider, and she was also a woman, which was also very new to me. And she was able to build such a safe environment for me to talk about it. And thanks to that, I was able to finally get on a healthier track.
I love that. But thinking about it, how many years has it been since that experience to now? How many years would you say?
I think it's been over 5 years.
Over 5 years. Gosh.
Mm.
When we think about going to our healthcare providers, it's always kind of like one experience will be great and, life changing for every 10 mid or not great experiences. And it's very sad that every time that we do get a really good experience, we celebrate it. And it's so exciting for us because that is just telling us it's not a norm. And that is why we have to celebrate any good experience. But more than anything, it highlights a gap that specifically exists within the immigrant community, specifically our Latinx community. And so in this episode, that's exactly what we are going to talk about, right? In the last episode, we spoke about discrimination and, microaggressions and inequality that our community has struggled through in our immigration and our education policies. And today, the healthcare system has entered the chat. And so we are going to discover the discrimination and the disparities that our Latinx community, specifically our migrant community, face when it comes to our health and our wellness. Primos and primas, welcome to your favorite podcast. My name is Andrea, and I am here with my cousin.
Everybody, I am the other cousin. My name is Jack, and welcome to our podcast, Ponle Acento.
Alrighty, Prima. So let's go ahead and chat about a lot of things that are going to be a little bit taboo. So in order for us to just get it over with, I'm going to say the S word because we're going to talk about that a little bit here and there. So here it is, primos and primas. The word is sex. We're going to talk about sex education, sex health, because sex health is health regardless. But before we get into that portion and before we talk about taboo conversations within our communities, we first have to dive into this idea of where we live will determine our trajectory of our health and educational future. Prima, have you ever heard the saying that your zip code can determine your future?
Prima, I actually didn't know about that until long after college. I was applying for grad school, and it was asking me if I was eligible for certain grants because of my zip code and because it was deemed to be part of this trajectory of health, and the fact that sometimes where we live, it's very unhealthy depending on, what factories are around or whether or not we have sufficient trees and parks.
Right. I love that you kind of introduced that topic because that is a perfect transition. The U.S. Department of Health and Human Resources labels something within our zip codes and areas of where we live, which are called SDOH, which stands for Social Determinants of Health. What does this mean? This means that based on certain topics or certain categories, that will really determine our healthcare access, our educational trajectory, and what becomes of us. And so those categories that the Department of Health and Human Resources identifies as those determinants are economic stability, education access, and quality. Quality is a key word here. Healthcare access and quality. Again, quality is a key word here. Neighborhood and built environment and social community context, which pretty much refers to relationships and interactions with our families, friends, and coworkers. So I think that I'm going to highlight the positive thing of our culture. And I don't mean to generalize, but I think this is also a little bit of a fair generalization. I think as Latinx and, brown individuals, we have that final part pretty well, that social and community context. I think that a lot of Latinx families really value their close knit families, and they are really always checking in on them. And one chisme becomes everyone's chisme just because we're so close to one another. So we have that part down, like A plus in that area, right? But all the other parts, right? The part of healthcare access, a part of education access, a part of economic stability, we really have to think about our immigrant parents. Where did they settle when they came to the US, right? Did they settle in the best parts of the towns? Did they settle, in the best part of the city? Chances are no, they did not. They did not settle next to a world renowned hospital with the best healthcare and the best university. They settled wherever the job was at because that is what they were seeking, financial stability. And so when we think about, okay, where did our parents, our immigrant parent or parents go? They went where there was agriculture, where there was factories. A lot of folks, and I know this is very prominent with Central American immigrants, they go into the inner city because they work in restaurants, they do sanitation, things of that sort. The key component here is that when you move into an area that is not the best quality of healthcare access, education, and economic stability, you are really working against pollution in air and water, especially like thinking about, for example, the Central Valley, right? We pride ourselves in being the breadbasket of the nation, right? We feed 40% of our nation. That is true, and no one can take that away from us. But think about, the pesticides that are used to make sure that our fruits and veggies are growing strong without any pests, right? And if you think about that and how that relates to our air quality and into the pollution that goes into our water, well, in addition to that, we have very, very short options of physicians here in the Central Valley. And I had the numbers at one point in my life, and I wish that I could remember them off the top of my head. But I know that the Central Valley, we're one physician per over 1,000 residents in the Central Valley, specifically in Merced County. And so I wish that I had the numbers up in the top of my head. If we do come across those numbers, we'll add it onto like an Instagram story or something. So now we have a shortage of physicians that can treat our largely immigrant community. Now, on top of that, our U.S. Census Bureau statistics show in 2022 that 73.1 Hispanics or Latinos of any race aged 25 years or older hold a high school diploma, compared to 94.2% of non-Hispanic whites. So that is where we are beginning to see the gap between education. And I'm going to call out our young men of color because a lot of that gap come from our young brown boys, because our brown girls are stepping up everywhere. And I'm so proud of us for that, but we are leaving behind our young men. So I'm calling you out, y'all. So if you're listening, this is for you. And so the next stat that the Census Bureau tells us is that 20.4% of Latinos hold a bachelor's degree compared to the 39.5 non-Hispanic whites. This is a really, really big gap, especially when we're beginning to think about why is it that we don't have many Latino doctors, Latinx physicians? Well, it's because our folks they're not getting that formal education. And so, Prima, does that sound at all surprising to you?
I think it's very interesting because the Central Valley has a lot of amazing, smart people.
Yes.
And oftentimes we're just not given access to these things.
Mm.
And so it's so hard. And I know so many people who want to go into the medical field, but unfortunately, as we mentioned in our previous episode, these institutions are not meant for us. Oftentimes we have exams that we have to take to even apply. They're so expensive. Tutoring for it is expensive. Textbooks, again, to study if you can't get a tutor are so expensive. And so, again, there's so much potential here, but these systems, they're just not meant for us. So it's so hard.
I appreciate that you bring that up because I think not only are we fighting against all of the different challenges that are being put against us, whether those are cultural expectations, family expectations, but now we're getting through these system barriers. And so a lot of the times we want to get that formal education, but we can't. And so then that trickles down to us having less Latinx physicians. So I'm so glad that you brought that up. So now, we think about the next point of the U.S. Census Bureau, and it talks about health insurance coverage. Our Latinx community is the highest uninsured rate of any racial or ethnic group in the United States. We have 16.8% of folks that have no health insurance at all, compared to a 5.3% of non-Hispanic whites. The second portion that I really want to talk about is 51.5% of our Latinx communities have private healthcare insurance. And I am privileged enough to say that I'm one of those individuals. And you're like, okay, that's not too bad. That's 50%. But when you compare it to 75% of our non-Hispanic whites, that is a really, really big difference. That means that 25% of folks are falling between the cracks. And so what does this mean? I think it's important for us to think about and really talk about those language and cultural barriers. We already have a very small percentage of physicians and surgeons that identify as Latinx. And actually the percentage is 7% of practicing physicians and surgeons in the U.S. identify as Latinx, while 9% of technicians and practitioners are also Latinx. So what does this mean? This means that, the communication and the tone that is required to speak to individuals of these communities are being lost in translation. And so when we think about the cultural barriers that come between our practitioner, it can be difficult to have to explain to someone, actually, I'm not allowed to get a pap smear, or actually, you know what, I was told I'm not able to get birth control, as you mentioned earlier, Prima. And I remember that actually when I was 14 years old, I was a freshman in high school, the HPV vaccine was pretty new. And I had gone to a physical. It was a regular physical to play sports in high school. And so I actually had a PA, a physician's assistant, who was Latinx, and she was a woman. And she, was one of those aha moments of like, that was a good experience. She sat down with my mom and I, and she said, I will really recommend that Andrea gets the HPV vaccine. And I understand that a lot of the times this is something that is difficult for Latino families. And, that's the word that she said, because I know that there is this belief and that, folks, especially women, will wait until marriage to be sexually active. And so she said, yes, she's 14, But if we give her the HPV vaccine now, that is preventative for the rest of her life so that she doesn't get cervical cancer. And so she had that conversation with my mom, and, she talked about what cervical cancer was and how that disproportionately affects so many women of color. And at the end, my mom did not have to think twice about it. She was like, yes, give her that vaccine. And that is why it's so important for us to think about physicians that will speak the language, not like the literal language, but also the cultural language of our communities, because there is so much that can be lost in translation. And it just takes one bad experience for a very, very busy immigrant individual to say, you know what, I missed work. I missed a whole day worth of my salary for me to have this mid experience. Like, they're not going to want to do it again. And that is how Latinx folks fall into having the highest death rates for heart disease, cancer, unintentional injuries, and stroke, because we are not good with that preventative care. And so a lot of the times when those physicians are not speaking our literal language of Spanish or, whatever that may be, or cultural language, there is that mistrust within the healthcare system. Mistrust within our culture has always been something very prominent, right? We don't necessarily trust it and trust anything. And we know that because of the consejos that our parents and great grandparents and parents give us, right? Of like, be careful, be careful. There's already that sense of mistrust. But Prima, I know that you're going to talk to us about a few cases that really, really highlighted that mistrust within Latinx community and our healthcare system. So let's hear it.
Well, actually, Prima, it's a great thing that you mentioned how it's important that they also learn our cultural language, because I do also want to note that a lot of our undocumented population here in the United States, specifically in California, didn't even have the ability to get health insurance until recently. So, not only was there the mistrust, but then our communities are unable to get the healthcare that they need, and therefore we don't educate ourselves on healthcare, right? So like the example I gave, how I went in for my period and all of a sudden I was being given birth control, and I was like, I thought this was only to not get pregnant. Yeah. And so after being explained that I actually had this other purpose as well, I was then able to go back to my mom. And when my mom freaked, I was like, Mom, it is because of all the stress. My body cannot handle it. It's not healthy for me not to have my period. And so we start to educate, our relatives. And thankfully, I was in the position where I had my health care and where I was able to go get the care that I needed. But speaking about like immigration, for example, right, in our communities, there's a perfect segue because we actually wanted to share some history with our listeners. And this actually starts with the forced sterilization and exploitation of women of color, specifically Puerto Rican and our own Mexican women. So, though we will start in the 1900s, it's important to note that Black women have also been exploited within the medical field. And because it is Women's History Month, Prima, I actually do want to talk real quick about an example from a Black community. So I wanted to start real quick and give the example of Henrietta Lacks. Henrietta Lacks was an African-American woman whose immortalized human cell lines were used for medical research and for commercial purposes. It's important to note that Henrietta never consented to her cells being used, nor did her family after her passing. And Henrietta's story resonates with our own Latinx history as we begin to talk about the sterilization of Puerto Rican women in the mid-1900s. So in the 1950s, Puerto Rican women were coerced into sterilization and used as test subjects when white doctors were developing the modern birth control pill. And so it's important to know also that these women were not given specific information about what the pill entailed. And there is actually a documentary called La Operación, The Operation, that actually interviews these women. And it's so heartbreaking to watch. And the reason for that is because so many of the women wanted to become mothers, or they had children, but they wanted more. And so not only were these doctors violating their bodily autonomy, they were also robbing them of their dreams. And the aftermath of these trials were, again, very devastating. And it was estimated that by 1956, 1 out of 3 Puerto Rican women were sterilized. And again, keep in mind that some of these women did not know they were going in for this procedure. The doctor would just do it in secret. Or those who did know were counseled improperly and were never told that it was an irreversible procedure. And unfortunately, this is not a singular event. As we continue throughout history, there is actually another case. This was in the 1970s, and this is actually where a whistleblower exposed evidence of rampart abuses at the LA County USC Medical Center, where mostly Mexican women were coerced again and were being sterilized. And so there was actually evidence that showed that Spanish speaking women were repeatedly approached as they were about to give birth. So they were in pain, they were about to give labor, and the doctors would come along and ask them to sign consent forms so that they could, help them out, do the surgery or help them give birth. And so this documentation was actually in English as well. And so they weren't even being properly translated at this point. And they were just being told that it was protocol so that they could, again, help them with giving birth. So we see this pattern where these women of color are being robbed of their rights to become mothers. And there's also a documentary specifically about this 1970s case that is called No Más Bebés, or No More Babies. And their stories are just as heartbreaking. And some women actually share how their husbands became violent because they were unable to have more children. And so not only were these women being exploited, but they were also being put in harm's way because of them not being able to have more children. So many women within this specific documentary also talk about the guilt and the shame that they felt because, again, within our traditional Latinx culture, women often have a lot of children. And some women want to have children. They want to be mothers. They want to be able to nourish their kids, send them off to, make their dreams come true. And a lot of the times these women, again, were robbed of this dream. And so I think it's important to, Prima, that at this point, we connect it to our realities, because this is an ongoing thing where women oftentimes do feel these emotions.
Yeah, absolutely. And I think it's really important for us to, recognize why there has been that mistrust that have come from generations to generations. And, we were just talking about how we both saw No Más Bebés as a documentary during college. This is hidden history, history that we do not know about. And, it wasn't for, Professor Cannon, shout out Professor Cannon, who showed and, that documentary that made me realize, okay, like, wow, this is so much more discrimination that I just often thought that discrimination just came in someone being rude to you, or, someone telling you to speak English and not to speak Spanish. But now we see that there is so much more to discrimination that has been intertwined within the policies, the history, and most importantly, and, unfortunately, most dangerously, within our healthcare systems and within immigration and within education. So, it's really not a good place to be. And I do want to share that I think that as we move on to our current generation of, millennials or zillennials and Gen Z, we begin to see a lot of women choosing to maybe be child free, whether that is a personal choice because that is what they have decided, or whether it's because they are unable to conceive or unable to afford, given our current world right now and the state of our country. And so it is really important to also recognize the cultural expectations that we as women have to be able to procreate and have children. And I think that there is almost a sense of shame, as you mentioned, Jack, in our previous examples, about how, like when these individuals got sterilized without even knowing yet, then they face shame from their families. I think that is definitely related to what folks and specifically women are feeling now, where there is that concern of like, when are you having children? When are you having children? I always laugh, but it's not it's not funny, but it's funny where I often see like memes or like TikToks about, cuando era adolescente, mi mamá no quería que me embarazara. Y ahora que casi tengo 30, se preocupa que nunca me voy a embarazar.
Mhm.
And I'm like, that is so real. Like, I think
Mhm.
that at least for me in my personal experience, I'm 30 years old and I have been with my honey for over a decade now. And so those comments that come from family is just, it's very difficult. And, I think that both you and I, Prima, are very highly accomplished individuals. And, I'm going to take the opportunity to humble brag a little bit. But we are incredible. We have really trailblazed the way in many, many ways, along with a lot of our other primas, your maternal, my paternal, where, we kind of go against all the different odds. And I think for me personally, to be able to, get a master's degree, like run a marathon, hold a high position within my job. I published 2 different books. And, at the end of the day, what I measured in success is that I don't have any kids yet. And that can be very difficult. And so I think that when we ask for folks that are listening in is for grace and for understanding. You don't have to have children to be able to be worthy of being a woman. And so I think for me that's probably even going to lead into my palabras de sabiduría. But I also celebrate and acknowledge the women that have chosen um, to be mothers, because our mothers are creating the future. And so I do celebrate that. And there are also mothers who were not given the choice to become a mother or not, especially outside of California. And to them too, I send them grace and I send them strength. But women are incredible. That's all. That's all I have to say.
Amen. Yep. That I have no words, Prima. That's exactly it. I echo everything you said. And I think, yeah, we're two badass primas. I love it. And yeah, to close it off, I just wanted to give one last example, Prima, because again, just reiterating the fact that this is all intertwined within the systems that we unfortunately live in. And so again, we might think that these sterilization procedures have ended. They're no longer happening. And I do want to point real quick that within the last case that I gave, which is 1970s here in Los Angeles, the women actually sued. And the judge ruled that the pain that these women were suing for, right, all the pain that was inflicted upon them, the judge ruled that the pain that these Latina women were facing and had was not because they were sterilized against their own will, but because they were unable to fulfill their Mexican duties.
Oh, wow.
So, of course, he ruled in favor of the hospital. So, again, history has not been kind, and it's hidden history, like you mentioned, Prima. It's so important to learn about this. We, again, always encourage our listeners to go and watch our documentaries that we know we pull this information from. One, again, is La Operación, talks about the Puerto Rican women. The second documentary I mentioned is No Más Bebés, No More Babies. And so, again, we want to encourage our listeners to go and also see these testimonies for themselves, because they really are heartbreaking, but at the same time, I think it's really important to learn. And so I close this off by also giving one last case that actually happened really recently. This was in the fall of 2020. And this was another forced sterilization at a for-profit ICE detention center. This was actually located in Georgia, here in the United States. And it was a formal complaint filed by one of the nurses at the detention center. And they alleged that the detainees were denied medical care and were possibly being forced into unnecessary hysterectomies. So we continue to see this in present times. And so it's so important that we always advocate for ourselves and for our families, for our communities. And as first generation, children of immigrants, oftentimes we have to translate and do the hard work. But I think now more than ever, it's really important for us to do so that our families can live a healthy life, so that, we can continue strong.
Absolutely. I know that there's so many people in our community that are doing the work right now. In the county that I live right now, there is health promotoras that go around, and they are like our moms, our tias, our grandmothers. What they do is they go as trusted community members and community leaders without titles, and they educate our communities about proper nutrition or about vaccinations. They really spread the word to ensure that our community stays healthy. And so we are beginning to see that awareness coming through. We're seeing that advocacy be, front line now. And then, of course, we're beginning to see more and more individuals that identify as Latinx challenge the systems and go into medical school. And so I will say that I understand that there is a new medical school that is up and coming here in the Central Valley at UC Merced. And so for our Central Valley folks, or really anyone within California, this might be a good opportunity for you to learn a little bit more about it and realize that this is a big accessibility opportunity for our communities. And I'll leave it at that. Prima, did you want to add anything else before we go into Palabras de Sabiduría?
No, Prima, I am so excited to share my Palabra de Sabiduría this week because I have a little surprise.
Hey.
For our listeners, I am back in LA, and wherever I go, every time I have a new apartment, I always have a specific wall where I put all of my family and friend photos, any little momentums. If I have like a birthday card that just really made my day, makes me smile. And Prima, a while back, we are both Trevor Noah fans.
Yes.
We love Noah. And you actually lent me his book. And I don't recall at the time why I was having such a hard time in life, but I was. And you actually wrote me a little note when you let me borrow the book.
That's right, I do remember.
So I looked at it the other day because I was putting up my pictures in my new apartment, and it just really spoke to me. So I thought I would share your palabras de sabiduría that you gave to me. So this week, my palabras de sabiduría are: you are strong enough to face it all, even if it doesn't feel like it right now. I think with these political times, sometimes we feel various emotions and we don't feel strong. Sometimes we have to put up a farce that we are strong for our family when we ourselves are going through it as well. Not just for our own loved ones, but for our friends, their family members. And so at the end of the day, we are all very strong. We have our own accomplishments that, again, as we end these episodes with the topic of discrimination, I think it's also important to give us that reminder that we are strong. We've accomplished so much. Sometimes it might not feel like it at that moment, but we are strong enough to face it all.
Oh, thank you, Prima. I also don't recall what the situation was. I'm glad that those words were able to mean something to you, so much so that you still have them today.
Yeah. Thank you, Prima. Yeah. I think our viewers probably have that one person that they always go to when they're feeling some type of way or need advice. And you're my person. So thank you for that, Prima.
Thank you, Prima. I love you, and I love all of my primas that are listening right now. Much love. My palabras de sabiduría are by the amazing and unapologetic Angela Davis. It's a quote, and it says, "I am no longer accepting the things I cannot change. I am changing the things I cannot accept." It's Women's History Month, and that has been our story every single time. No one will change things for us. We have to do it ourselves, just the way that we have been able to do it. And so shout out to all the trailblazers who have led the way and led the path to be where we are today. And now it is our responsibility as mujeres living in 2025 to set that for the next generation to come. And so with that being said, Prima, where can our followers send us a DM or follow us on social media?
So you can follow us on Instagram at Ponle Acento Podcast. As a reminder, this episode and the previous one was actually thanks to a follower who DM'd us, who actually suggested that we talk about the topic. So if you have any suggestions as well, you can feel free to email us at ponleacento.podcast@gmail.com. Or you can also, again, shoot us a DM, a message on Instagram at Ponle Acento Podcast.
Right on. Thank you, Prima. And to wrap things up, this podcast is brought to you by Andrea and Jack. It is co-hosted, co-produced, and co-directed by both Primas, Andrea and Jack. Editing of the recorded content is done by both Primas and Andrea and Jack. Social media and outreach is done by Jack. Research on discussed topics is done by both Primas, and sources can be found on our link tree. We aim to make the platform nonpartisan in the case that an opinion is expressed. Those opinions belong solely to the person who expressed that opinion. For accessibility features on the podcast, please visit our YouTube channel for captions and script of the episode. And that is all, Primos and Primas. You'll hear from us in 2 weeks. That is all.
Love, A&J.